We are here in Columbia, overlooking the campus on top of the city at the Broadway Hotel with the president of the University of Missouri System, Dr. Mun Choi. Dr. Choi, welcome back to the show.
Thank you. Great to be with you again.
All right, so of all the places in the state that have had COVID issues and had to go special precautions, the University of Missouri has taken some extraordinary measures to try to keep students safe and stop the spread. Walk folks through some of the precautions you've taken to keep the students safe from COVID.
Sure. Well, it started up by having a fall semester that was going to be different. We wanted that in-person experience for our students, but at the same time, taking into account the masking requirements and social distancing. So many of our classes that were in person had to be located in buildings and classrooms that will allow for social distancing. And so our largest building, as you know, for gathering is Jesse Hall. In Jesse Hall, the auditorium can seat about 1,800 people if it's fully packed. But with social distancing, we have about 100 students who take classes in biology or psychology, but that provides us with the safe measure of putting on a mask as well as social distancing. And so far, it's going well. It's going well.
So folks that on campus, I guess you're spaced out a little bit more in classes, you're wearing masks. I even see outside in Columbia, you have to wear a mask in certain places on campus. I've heard some folks push back the other side and said, you know, there was a lot of hand-wringing when kids come back to college. There were going to be lots of deaths and illnesses. From what I've seen from the outside looking in, that has not happened. A lot of cases, but not a lot of hospitalizations, not a lot of no deaths of any students, correct?
That is true. And we had a peak of about 700 student active cases back on Labor Day. But since then, we've come down 90%. So we are now below 70 active cases.
Of those students, were they hospitalized? Have you lost a student?
We are not aware of any student that was hospitalized because of COVID. And we've had over 1,700 cases. And we knew that students would recover, typically between a 10 to 14 day period. And I'm also happy to report, with the exception of one student that we are aware of, all students who recovered from COVID are back in their studies. So
that's outstanding.
Yes.
So some folks would say, well, maybe you're going a little far. Maybe you're being a little too aggressive with some of the precautions. You know, if I talk to my dad and mom, they'd say, well, if you're a young person, you're not even going to know you're sick.
That's right.
Do you hear folks, do they even get to you? Because I hear them. Maybe it's a little much on campus. Maybe a little too far.
They do. I hear from our faculty, students, staff, alums, and just Missouri citizens. They'll send me emails and saying that some of the measures that we have are going a little too far. But being trained as an engineer, I always like to have a safety factor, just to ensure that we account for things we don't know. And when we started this out back in March, addressing the pandemic, we closed the campus when there was only one known case.
Sure.
One known case. And if someone had told me that back in September, we're going to have a total of about 1,700 cases and we would still be open, I would think that just can't be right. How is that possible? But it's through active planning and also thinking about scenarios that can occur. And so with the COVID crisis, there are things that we may have gone a little too far, but we pull them back. For example, we made it a requirement that once you're outside, even if you're walking alone, you need to wear a mask. But we heard back from the community about what that would do in terms of students' mental health and so forth. And we listened to our medical experts and we pulled that back. So masks are required if you are outside and you cannot maintain social distancing. But as long as you can maintain social distancing and you're exercising, playing Frisbee, no masks are required.
So the one thing I've always admired about you is you're a data guy. You're being an engineer. I've heard you, when you just give a regular talk, you talk about data. What is some data points that you're going to take into account as you start to roll things back? When a student says, okay, let's say he's a junior now, he says, okay, my freshman year, I want it to be like that again. What's the data points you're looking at that can roll these restrictions back and make it like that experience was 2 years ago?
Absolutely, and I wish we can roll it back tomorrow if we can. But in being mindful of the health effects, not only to our students who we know have contracted it at a high rate, but the transmission from our students to our faculty and staff is concerning.
To the community, right?
To the community, absolutely. We have a responsibility. And we believe that the social distancing and masking, especially in indoor spaces, has worked. That's why we're seeing the declines in number of active cases. I believe that with the combination of having a vaccine that can be rolled out very quickly, hopefully it can come to Columbia early part of next year. With that, I would see that we will begin to relax some of the regulations so that we can have a more normal in-person experience for our students.
So in reality, folks are looking at a vaccine before things get back to normal.
That's right. A vaccine, according to the public health experts that I'm listening to, not only from the CDC, but Boone County, and the experts that we have at the university, that is the best measure for us to start reducing the restrictions that we have.
So there's been a lot of effects of COVID that are more than just people getting sick. The budget's been taking a huge hit on every level. My assumption is higher ed, it seems like every time they do withholdings, higher ed gets hit first.
That's right. And we've had cuts from the state, and we know that it was inevitable because of the economic downturn that all communities were facing. We are grateful that the governor released some of the withheld funds yesterday that go a long way for us to meet our mission as a university. But the decision to open was based on many factors, including the fact that we live our lives by managing risks. And we knew that there would be risks. We knew that students, when they came back to the campus, would contract and spread COVID. We've seen that at universities that opened before we did. But we had plans in place with quarantining space, contact tracing, and the hospital facilities to manage that situation. We learned a lot during that process, which is to say, overestimate the number of cases as opposed to underestimating. And by putting in the resources, we have been able to see the dramatic reduction, the 90% reduction. But we also feel that we are a very important component to the economy in this region and to the state.
Sure.
We create the workforce. We do research that benefit farmers in rural Missouri to developing the types of educational programs that reduces disparities in inner cities as well as rural region. That's a very important endeavor. And for us, it was important for us to then find ways to have in-person, that rich experience for our students, and our faculty and staff have stepped up.